Hi, it's John Linkus, and welcome back to another one of our leadership series, executive series for telemedicine. And I'm really pleased to be here with Secretary James Peake, who is, among many other things in his career, is president of the American Telemedicine Association this year. Welcome, Dr.
John,
Peake.
it's good to be with you.
Good. So you've had a tremendous career by any definition, graduate of West Point and 39 years in the military as a medical doctor and a cardiac surgeon, is that right? And then ending up Surgeon General of the Army as a 3-star lieutenant general. And then from there, as if that wasn't enough, President Bush appointed Dr. Peake to be the Secretary of the Veterans Affairs. So, and then after that, all that's aside now, the real peak of the career is he's president of ATA. But in all seriousness, I can tell you this from a personal perspective. It's been a real pleasure and a learning experience this year, and ATA is really been benefiting from your leadership this year. So thank you for all of that. Now, having said that, I think it's important for us to learn, and I'd like to know a little bit more about why you chose to go into ATA and telemedicine. What drove that decision for you?
Well, John, first let me thank you for your 20-some years here at the ATA and the leadership you provided as well. And to be honest with you, my association with ATA goes back almost that same distance when Russ Zychek and I were engaged with the early days of ATA and the military's leadership really in telemedicine. So I've been a believer of it for a long time. I took telemedicine with me into Grenada when I was the chief medical officer for that operation. I can remember taking the capability into Mogadishu and Somalia and trying to convince people that it was okay to reach back and talk to Walter Reed. And then, of course, my time in the VA, which is another organization, has been a leader in telemedicine, has made me a believer in where this thing is going. And I think it's fundamental to the future of healthcare, not only here in the United States, not in the VA or not in DOD, but globally as well.
And so in your time in the military, because ATA has worked with many parts of the military over the years, and it kind of evolved from a lot of research and pilot projects, just like in the civilian world, but it really then morphed into something that was actually in the battlefield. And I think you were there for a big part of that transition. What were the challenges that you faced, and what's the lessons learned from that?
Well, I think there's the history of telemedicine is that, I guess the first real instance was 1967 or something up at Logan Airport in Mass General or whatever. But the technology has come a long way, for one thing. The communications infrastructure has come a long way, for another thing. The cultural acceptance has come a long way, in another thing. So all of those things were challenges along the way. You would find great champions that would start something and then move on to a different location. And we weren't necessarily that good at systematizing the advantages that telemedicine could give. And I think that's where we're starting to see different. There have been lots of pilot programs over the years, not only in the military or in the VA, but in states. And I think that what you're starting to see is health systems starting to realize that this can be a better way of practicing medicine as it complements the health system and the way they're doing it. And so I think, from the lessons learned, it's applying what we have learned, and that's why I'm so excited about our practice guidelines that ATA does, because it starts to lay out what, from a broad experiential base where what people can glean from others' experience in terms of best practice. And they'll continue to evolve and continue to change, but I think it's the lesson is sharing, and the lesson is being persistent, and the lesson is moving the telemedicine into the mainstream workflows.
So in that, and I think you really summarized not only the transition within your career and observation, but I think what a lot of healthcare and health systems are looking at the same time, a movement from a pilot project on. And one of the challenges that many people talk about has been the resistance of the physician in the field. And I suspect you had that in the military and VA. And what were the things that you felt were a way to overcome that with the individual provider, be it a physician or anybody else?
I think, first of all, is to let them appreciate that they are part of a bigger system that can complement what they do, not replace what they do, or not disrupt what they do. I mean, I found it in Bosnia, it's not, you know, even back in those days, I found an ophthalmologist that was communicating back to Landstuhl with, you know, basic telemedicine capability, so that he had that backup, and it made him a better clinician and more reassurance to the patient, and the system had more confidence in what we were able to do in the field. We had radiologists that had capacity at Landstuhl that could read those films immediately and pop the result back, you know, within a short period of time, and not necessarily have to have a radiologist in every location in Bosnia. So it starts to say we can do things better offer a higher standard of care and expertise at the point where, in that case, the soldier needed it.
So then we move on to the Veterans Administration, which by, I think everyone who has looked at it has said probably the largest user of telemedicine.
It's the largest integrated healthcare delivery system in the country.
So it would make sense. But to what extent people have said, well, it is because it is an integrated delivery system, and that won't work for other health systems that don't have that same financial package or approach. You've had that experience with them, and they've certainly been, I think, by all extent successful.
And they have published their results, and
right.
they, you know, you can see the savings and the avoidance of readmissions and so forth. And when I was Secretary of the VA, I'd always stop at the telehealth unit, and I'd, you know, get a chance to talk to a veteran who was umpteen miles away, and they were always appreciative of the fact that they had telemedicine. They didn't have to come, you know, X hundred miles to get their blood pressure checked. And oh, by the way, they knew that Nurse Nancy there was going to help them if they had it. So there's a human element of it. It's not just technology. Yeah. It is a leveraging technology to enhance the human experience. And I thought the VA did a really good job of that. And, you know, they continue to evolve. I mean, this is all never a stationary story. Now Neil Evans, as you know, is the running Connected Health for the VA. Dr. Shulkin, the Secretary of the VA now, former Undersecretary, actually was seeing patients with telemedicine. So it continues to evolve and grow and benefit veterans.
Yeah, and I think it's important to note that Dr. Shulkin, who spoke at our meeting last year, has been an outspoken advocate. He's now actually the Secretary of Veterans Affairs. And every time he goes to Congress, I've noticed, maybe not every time, but almost every time there's a testimony, somehow the subject of telemedicine comes up. And I'm sure that was the same thing with you. It just seems to be one of the highlights that people like to point to.
Well, and for good reason. It adds value to care. It adds, you know, it hits all the aspects of the triple aim. The patients love it. The quality is good, and it is cost effective.
Yeah, and I like the way you put it, how it helps the individual physician provide better quality care. So now, in the last few years, you've been out in the larger world of all of healthcare, not just VA or not just military.
Sure.
And
CGI is a global healthcare provider, or rather global IT services provider, and the reason I joined it because it intersects with health in such a interesting way, and. You know, when I meet with CEOs of health systems and innovators in health systems, telemedicine always winds up coming up as part of their roadmap for the future. And it's very consistent that they are trying to figure out how to approach it from a systems perspective and achieve their strategic objectives, which really are around the triple aim.
So as you work with a lot of the large health systems around, not just this country, but it's around the world, you've been working with a lot of health systems in your current role. But what are the challenges? It seems like the interest is growing, certainly from many sectors, but there's still kind of, it seems like some areas that need to be overcome, and maybe some areas that ATA can help with that. But
sure. Well, I think there's a variety of things that have happened that are different, even from when I first joined the board. I mean, you're starting to see payers out there saying this is part of our benefit package. Mm-hmm. And they're doing that because patients are starting to say, I want that as part of my benefit package. Mm-hmm. And employers are starting to say that. And now even independent, even employers who are self-funded, using TPAs, but are self-funded, are saying, wait a minute, I can get a better, keep my employees at work, and I can reduce my overall healthcare costs and have happier employees. So, those are all kinds of things that are really starting to come around. We've seen them, as you know, John, over the years in different pockets, but I think there's wider acceptance of that. In fact, in the National Defense Authorization Act, clear specific language about expanding telemedicine, because people are starting to recognize that this is no longer a, quote, fly-by-night. This is here to stay, and we're well past the tipping point.
Oh, yeah, yeah. So then I would have to ask you, looking ahead, you say we're past the tipping point, and we're certainly there, and there's a lot of interest, and certainly as the ATA and as even on the board of ATA, I'm sure you're getting a lot of people coming to you and saying, what advice do you give us? What steps can we take? Where should we be going looking out 5-10 years? Where's this going, and what should we do now?
I think, well, from an ATA perspective, we need to continue to push to diminish the regulatory barriers. Mm-hmm. We need to continue to be absolutists in terms of that this has got to be quality, which it can be better quality, frankly, and be able to give people the reassurance of that. I love the fact that we've moved into the accreditation and pushing accreditation forward. There's too many charlatans in medicine in the face-to-face world, and we want to make sure that doesn't encroach into the telemedicine world. We want to be able to give people assurances of that, and so I love the guidelines and those kinds of things. And I think those are the kinds of things that people that are trying to put this in as a system can use as kind of their rudder of moving forward to make sure that what they are providing is quality and that it's integrated into their process, not a standalone off to the side.
So I'd be wrong if I didn't also take advantage of the fact that you've been involved in the highest levels of the government for a long time. And of course, we're now in the process of re-looking at how nationally we're going to look at healthcare. And Congress is busy, I think, worrying and rolling their hands of what they're going to do. Medicare, of all the payers in healthcare, it seems like Medicare has been the one that's been dragging their feet a little bit, maybe intentionally, maybe because of the program. But as we move ahead, I'd like to get your prediction in terms of where we're going to be, not with the Accountable Care Act, with some of the larger issues, but specifically with telemedicine and kind of how that's going to be affected.
First of all, CMS, I think, has been dragging their feet because of the fear of overutilization. Mm-hmm. And I think those fears are probably starting to go away, despite some recent articles that I think were short-sighted in their approach to it. But the fact is, you start to say, well, they're starting to soften a little bit in the bundle payments. They're starting to soften a little bit in the Medicaid. They're starting to soften. And so I think that they're not an organization that does big gear shift changes, but I think if they're smart people there, and over time they're going to adopt the best practices, and telemedicine is going to clearly emerge as a best practice, I think.
I would hope so too, and maybe even a standard of care at some point. Well, great. Well, this has been wonderful. Any other points of advice you'd like to leave?
Well, I think first of all, with ATA, I mean, I love coming to our conference. The quality of the people is extraordinary. The passion for what we're doing is extraordinary. As an officer for the last couple of years, I've had a chance to work with the SIGs and see the kind of work that goes, the engagement at that level. And so I would just encourage our members to stay engaged as we look at our strategic plan going forward, engaging our memberships in an increasingly meaningful way. I know is one of your major thrusts. Absolutely. And I just applaud that, and I applaud them.
Well, great. Well, I would applaud you. As I said in the beginning, I think you have added a tremendous amount to the association, certainly to the board. I think we have benefited from your military training and background to put a little bit of the rigor, but also I think the passion and the focus on taking telemedicine to the next stage. I think we're probably onto something really big here.
Yeah, no question. Thanks, John.
Thank you, Dr. Peake. Appreciate it. And we will talk to you again with the American Telemedicine Association.